Welcome to Medcast. Here we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. My name is Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai, and my guest for today is Dr. Alexander Machado. Dr. Alexander Machado is a neuropsychologist in Dubai. Dr. Alexander, welcome to Medcast.
Thank you very much for having me.
It's our honor really to have you, especially that I learned that neuropsychologists in Dubai and in the world in general are not so many.
Yeah.
So we are privileged to have you here with us.
Thank you very much. It's
Yes.
my privilege to be here. Yeah, actually, we are in Europe. We have already quite a few neuropsychologists, but here in Dubai, actually, we are I think just two or three.
So this is a big honor to have you. And we want to introduce our audience to neuropsychology.
Yeah, neuropsychology is the intersection between the science of behavior and neuroscience. When we go to clinical settings, it's the combination between psychology, clinical psychology, and clinical neurology. So this is basically what a neuropsychologist does. If I was a mechanic, for example, I'm the guy that sees not only the driver of the car, but I will check also the engine. If you tell me, look, my car is spending too much gas, I will see not only the engine, but also the driver. When I discover what's the cause of that, of you are spending too much money in gas, I will send you or to the neurologist, or to the psychiatrist, or to the clinical psychologist, depending on what's the event that's causing that. So this is, in a gross mode, like in a very rude mode, what a neuropsychologist does.
Yeah, but this is like bridging the gap between psychology and neurology, because sometimes they are interconnected directly. When, for example, I was mentioning to you about a patient who has a bit of developmental delay, neurodevelopmental delay due to like premature birth, and later on in life, because of her condition, she is bullied on daily basis. So here we have her psychology is affected, and here, of course, she has already the neurologic deficit or defect. So here where they need this holistic approach, let's say, to these two conditions.
Yeah, in fact, the neuropsychology, what we do usually, the neuropsychology will approach the neurodevelopment disorder to see if we can stimulate it, rehabilitate in some way, because there are some conditions that we can rehabilitate, depending. If even the intellectual disability, we can improve the quality of life with neuropsychology tools and ways of treatment. And of course, the neuropsychology is prepared to see the psychology factors that are affecting that. So all of these intricacies, the mixture of these dimensions, the neuropsychology is prepared to see. It's trained to see. But usually what we do is, when we see that something that's pure psychological, we send to the clinical psychologist or psychiatrist, depending.
True.
If we see that we need intervention of the neurologist, we send to the neurologist. Then the neurologist, sometimes they send to us when they need a rehabilitation plan, stimulation plan. So this is the way that in Europe we are working. So we work in a team. Neuropsychology works a lot in teams. So,
a multidisciplinary team.
Yeah, I work with neurologists. I work with clinical psychologists. One of my specializations is to work with neurosurgery teams. I do something called the brain mapping for neurosurgery, for epilepsy, or for neuro-oncology. The brain mapping is to understand what is the functionality of that part of the brain. I do the awake assessments. The assessment, most of people have already seen it on TV. Those surgeries that I made with the patient awake with the brain exposed. So I do that kind of assessment as well, the functional assessment.
Yes.
So all of this is what a neuropsychologist does.
Yes.
Not only this. Then we have also the neuropsychotherapy. It's the psychotherapy that we not only have the information that our patient is giving us, but also the neuropsychophysiological information. We connect some kind of a functional EEG in the brain and see the brain activity, the electrical brain activity, see if there is I beta, theta waves, move waves depending if you want to see if there is some mechanisms of defense. Imagine I'm asking you something about your father and you're telling me, no issues with my father. And I see that there is some psychophysiological activity in this response. So I have both responses. So
Yes.
I can go deeper into this question. So it's like it's like those machine, the lie detector machine.
Right.
Not like, but
Yes,
it's...
yes, I understand.
So we can go deeper in. So it's a neuropsychological intervention. So the neuropsychology field is a very wide field. We work usually always in teams of neurosurgeons, neurologists, leading teams of clinical psychologists. We do now we are doing as well the neuropsychoeducational assessments, because in order to do a psychoeducational assessment, we need to see if there are any neurodevelopment issues, because if we cannot do a psychoeducational assessment without seeing if there is any neurodevelopment conditions in the base. So it's a new thing that we are doing, psychoeducational assessment. So we intervene in lots of fields so it's a big field.
Very diversified, yes.
Very diversified.
So for my information only, when did the science of neuropsychology start?
The science?
Yeah, I mean this field, or when they
when
decided
it started,
there is a need for something like this.
It started for example, in Portugal. We have a well-established neuropsychology society since 2007.
But it's still not long time ago.
No, not long time. But in the United States, 1990 something, because initially.
It's still a young field of medicine, let's say, because
it is
it's
a young field.
New
and it's going to, in the beginning, neuropsychologists were attached to psychological societies, but now the movement, the future is, because it's so distinguished from clinical psychology, even if we have the base of clinical psychology as well, but we have a neuropsychologist takes like 7 years to in order for you to be a neuropsychologist, you need 7 years, because you need a lot of training. We passed 2 years in the medical school because of neuroanatomy, functionality of the human, the brain, the psychopharmacology. So all of these disciplines that we have to know, we have to really understand in order to because our field is the field that we connect everything
together,
we connect everything, all the pieces. So it already existed. Now what we are doing now is it's going to in a pathway that is going to be a unique specialty. We are going to have like societies of neuropsychology. This is the future.
Yes.
Societies of neuropsychology, because it's very distinguished as a field
and
of
it's very
expertise.
much needed, especially with the new research on the brain and how the brain affects the whole body. And
actually it is, because everything is neuro. I think that everything in the future we're going to have. I believe that in the future we are going to have neuropsychiatrists, neuropediatric, everything is going to be neuro, because we cannot disconnect this part of our being, of our existence. We are the result of our genetics, the neurological compose, and the environment. So
exactly.
Everything is neuro.
Before I move to the coming question, I want just to summarize that neuropsychology can help in different aspects, neurologic diseases, whether they were people are born with, or they develop later in life, from strokes to other things. Neurosurgery, neurosurgery, we said yes. So all those who have done or underwent a neurosurgical procedure, they require help from neuropsychologists. Abnormal electrical activity from epilepsy and all these abnormal electrical activities of the brain, in addition to psychiatric diseases and psychological problems.
Yes,
so it covers everything related to the brain.
It's a 4x4 discipline.
And for an effective team, neurology or psychiatric team or psychological team, a neuropsychologist should be there with them.
Usually, what the neuropsychologist does is he assesses and gives his suggestion of diagnosis and treatment. So then he makes reports. We do reports and we send it to the neurologist, to the pediatrician, and he sees, okay, let's get together. What do you think we have to do here? What do you think it's the differential diagnosis here? So we discuss a lot. It's we really are in my opinion, the cement in the teams in the clinical teams.
Yes. But you are able to also like manage patients face to face, let's say.
Yes,
directly.
Yes, of course.
Yes. So I will come to the second question, because as a pediatrician, I see that the cases of ADHD, not only myself, like the research has shown that the data that we have, ADHD is increasing, cases are increasing. Autism also, the autistic spectrum disorder is also, we are, of course, like since previous years and since that time, we have more and more cases.
Yes.
So how a neuropsychologist can help in these very common increasing like numbers of ADHD and ASD?
Yeah, well, first of all, this condition, ADHD and autism, we call it neuropsychological conditions. So they have to be assessed by...
They are the core of neuropsychology.
Yes, they have to be assessed by neuropsychology, because this is a change in behavior that has a neurological or genetical cause for autism or ADHD. But the thing is, what I think that there are lots of cases actually, but there are lots, what that has shown us, the studies of neuropsychologists done has shown us, is that there are a lot of false positives. There are people that are being diagnosed with ADHD and autism, and they really don't, especially ADHD, that one study shows us that 86% of people diagnosed with ADHD, they don't have it. Wow. They have another kind of and it's really easy to, to be misled because what's happening
easy
now...
Easy to label them.
Well, this is the problem, in my opinion. Because there are not much neuropsychologists, clinical psychologists are doing it. And clinical psychologists are not prepared to do it. They don't have the academic background, they don't have the experience, so they are just applying tests, okay? In order for us to have a diagnosis of ADHD, it's not only the test. Sometimes you can have a result in a test that says, okay, the result shows us that you have ADHD, but sometimes the cause of ADHD can be social, can be genetic, can be a medical condition, can be... one thing that it causes a lot, ODD, it's the defiant disorder. Kids that have defiant disorder, usually they are always diagnosed with ADHD. So there are lots of causes that can cause that result. So we don't look only to the result. Today, a neuropsychologist looks, for example, to the EEG. It's very important to do, while they are being tested, to see the I beta and beta activity in the frontal part, in this anterior cingulate, the frontal part of the brain, if there is I beta or beta activity. If you have normal I beta and beta activity in the frontal part of your brain, most probably you don't have ADHD. Wow. So you have another condition that we need to explore. So when we do an assessment, actually, we assess... for example, if he's a kid, I assess social, I understand the network of the family, I do the functional EEG, of course, I do psychopathology, I do psychological assessment, personality, self-concept, what is the conflict, how does this child see himself, how does he see others.
You do MRI for the brain?
Not needed for ADHD, only when we do MRI is when we have suspicion that there are some morphological issues that can influence, like tumors or stuff like that. If we have, like, I'm seeing the kid and he has nystagma or something like that, I say, okay,
if indicated.
You have to go to the neurologist.
Yeah.
So,
but EEG is required.
EEG, yes, functional EEG. So
because many they don't do for the ADHD. They don't do. But I cannot, blame them not to do, because this is a new thing. So this is a new. So usually they don't know, they are doing their best for sure. But now things change. I think even DHA is going on the right way in this. I was in a meeting last month. So they have this Canadian team of people working on mental health. So they are now doing the specialization, seeing who does who, and so they are doing a great job in this direction. So to have a diagnosis of ADHD, we have a lot of personality comes into place. After this, we do the cognitive assessment with the battery of cognitive dimensions. After the cognitive assessment, we see what is the deficit, and we specify. Imagine that you have a deficit in auditory attention, but not in visual attention, in divided attention, not on sustained attention. So I go and I specified with a task for that part of your brain. Only after that, I put everything together, and I do my recommendation. So
it's not just about applying tests, because if not, we had just testologists, applying tests. And that's the problem of false results, because we are having clinical psychologists, of course, for sure doing their best, but doing false.
Lot of
and even psychiatrists,
false positive, as we
and
say.
Psychiatrists sometimes they do this eye diagnosis. They look, okay, it's old school, the mother said he's very active. And so maybe they are doing this Connors thing. Connors is
and unfortunately they go immediately on medications. Many
that's
of them.
the problem.
Yes.
So
and the medications are for life. So if it's a misdiagnosis, really we don't need the children to take these unnecessary medications if it's not needed.
Of course, and the medication for ADHD has a lot of consequences. And
yesterday, a mother told me, my child is very active, he has ADHD, can you check? I said, the school is complaining about him. She said, no, I said, it should not be any problem.
That's a problem,
Yes, even for mothers' diagnosis
they
now.
They make a pressure.
Because of the social media, I think. Which has it has, of course, the great role, social media, for awareness, like what we are doing now.
Yes, of course.
But on the other hand, they can hear a lot of other like information that can be,
It is, because
influential on the parents.
Yeah, people are absorbing information that already shown by other people, and it's not, it's not dense. It's not. I think that schools in general in the world, they are. The model of schools today, if we see it, it's patronizing our children, not my children because they're already men, so are 28 and 25. But I think that schools in our days, they are in some way preparing kids to be or consumers or producers. They don't give them tools to be free thinkers.
True.
They don't give them tools to feel, feeling. It's being in touch with our feelings is what's going to make us in the future be men and women capable to do peace, for example. Sure. So it's the function of the fathers now, the parents, to do this, to expose our kids to their feelings.
Yes.
When you feel, you get, you in my opinion, when you feel and you start thinking, that's the role of the father, you start to pass from being nobody to somebody. In this world, it's a world that's pressuring you a lot to be nobody. Right. To put you down. And so we have to teach our kids to be somebody, to think, to feel. And parents today are not doing that. They are just, trying to give them everything, I need to give everything. And the most important thing is not about, their giving them everything, but teach them to do the best they can with everything they have, that's the thing, not to give them everything. And so I think that this is
very well said.
It's a cycle of this. Even the other day I was seeing a parent saying, I'm very tolerant with my kid. And I was thinking, it's not about being tolerant, because tolerance is being misused, tolerance it's not a virtue.
Maybe you are prohibiting the child from information he needs to learn.
Yeah, but in this tolerance, if the tolerance that you were talking about, it's misused and is making your kid, you are tolerant to indiscipline, to indulgence, to disrespect.
You're not helping your child.
You are not. You are being tolerant for the wrong things.
For the wrong
things. I think that we are seeing this wave. It's a big conjunction of schools, fathers trying to be best friends of their children instead of being their father.
There should be a wake up in this. We are parents. We are the leaders of the whole house. So coming to how can you help the children with ADHD and autism, but in summary, like you provide protocols or therapies?
What we do for ADHD, it's 2 words: cognitive stimulation for ADHD. So we have these scientific validated tests. It's like in form of games that while we are connecting them to a functional EEG, we make them do. We know that those specific games, it's called Vienna test system, and Cogniplus, Reacom, so there are different scientific tools. It would stimulate that part of their attention, specific part. We do neurofeedback, clinical neurofeedback. We have to be cautious because there are some crazy neurofeedbacks around there. So clinical neurofeedback. And now we are doing TMS, transcranial magnetic stimulation. So these tools, especially, for example, transcranial magnetic stimulation, we are using it with a great success in ADHD.
Great news. The question now is very important about anti-aging and how neuropsychology can help us stay young.
Well, actually, that's a great question because all of us, we want to have quality of life because we have kids and we want to, live as much as we can with quality. So one thing very interesting about TMS is that it was shown that because it has an influence on our brain electrical activity, it has a brain on delaying the activity of certain neurons and certain patterns that signals our body to start aging. So we call the sarcopenia. The sarcopenia is the aging of the muscle tonus. This is very important because the muscle tonus will make our wrinkles, the body will get,
Yes.
So now actually in Florida, they are these clinics that have this specific TMS, RTMS, repetitive transcranial magnetic stimulation, repetitive, to be used in anti-aging, and it's great because they are getting better physically and the appearance. The mood is getting better because they are less anxiety because it improves the anxiety levels and depression and the cognitive level. If we are declining with age from 40 years old, we are declining our cognitive dimensions. So TMS, it will improve as well your cognitive attention, memory, everything. So it's a win-win situation.
It can prevent Alzheimer and these kind of diseases.
Because Alzheimer is the accumulation of this beta amyloid that TMS will
and microvascular disease, and
of course we use it in stroke and everything.
Exactly. So I think longevity starts in the brain, whether in the psychological part or in the anatomical part.
Yes.
So yes, Dr. Alexander Machado, thank you very much for all these insights on neuropsychology, which I think many people are not aware that what is it in reality and where it can help, and for the information also about ADHD, autism, and longevity. I leave the final word for you to our audience.
Well, when you have when your kids have problems, they feel that please try to find a specialist in neuropsychology. It's very important, the neuropsychology, the assessment to be done by neuropsychologists. I know that we are a few here, but try to find someone that has some kind of specialization, that has the concept of the neuros. So this is very important.
Yes. Okay. I think we need another podcast with you. Thank you very much, Dr. Alexander Machado.
Thank you.
Thank you.